Okay, welcome everyone. Thank you for all taking the time to listen and learn about our program development project. We're the ATRC team consisting of Marco, Leao, Kayley, Goertzen, Phillip, Soncasie, Abby, Gentile, and Marisa, Thum. Instructed by, of course, the wonderful Matt Melko. So our agenda for this presentation has 6 parts. First, we'll review our needs assessment and how those findings drove our program development project. And we'll discuss the implications of these needs in our program, move on to our program goals and objectives, strategies for our program evaluation, discuss the resources and inputs needed for our program, and lastly, tie it all together with our logic model. So from our needs assessment in collaboration with the ATRC staff and other key informants, including the Office of Equal Opportunity and the Risk Management Office, we identified 3 needs, which are listed on this slide here. And they were the need to, 1, increase awareness of the services the ATRC offers for employees, as well as the need to address and combat stigma on CSU's campus regarding disability. 2, to measure outcomes for employees who received ATRC services in order to adjust the services to meet client-specific needs. And lastly, 3, to measure overall program effectiveness of the ATRC for funding and research purposes to objectively show the value of the ATRC. The underlying causes of these needs were determined through conversations with our key informants. Need 1 seemed to be a theme across the Office of Equal Opportunity, Risk Management, and the ATRC. One cause of this was that the ATRC has historically provided services to students, and many employees were unaware that they can also receive services here. This leads to the lack of awareness of the ATRC. The cause for the need to measure employee outcomes and program effectiveness is the growing number of employees that the ATRC is serving and the evidence of the importance of outcome measures in AT service delivery. So the ATRC has seen an increase in employees seeking services in the last few years, which is great, but they feel somewhat unprepared to serve them as best as they can due to their lack of a systematic process for measuring employee outcomes and the lack of an appropriate measurement tool to do this. So after further evaluation among our program development team, as well as with the ATRC team, we kind of revamped our needs. So we determined that at this point in time, addressing such a major and overarching issue of stigma on campus and ATRC awareness is not currently feasible. In addition, as the ATRC does not currently have an outcome measurement process that they are confident in to ensure services are effective for employees, it does not feel like the appropriate time to try to expand those services that they're not effectively certain are effective. So for that reason, this need will be better addressed down the line and was not appropriate for a program development project. And after more discussion and problem solving, we determined it'd be appropriate to kind of combine needs 2 and 3 to create one overarching need to address with our program, which led us to our finalized need that we plan to address, which is to measure client workplace outcomes and overall program effectiveness.
So if left unaddressed, this need could have a negative implication for both clients and ATRC program itself. So not having an established outcome measure can compromise the assessment and intervention process, which in turn can directly impact clients' participation, occupational performance in their work roles, and in their productivity, and affect self-esteem. So without adequate measurement, there's a potential risk that we are not able to address clients' real needs, and this also relates to the implications to the ATRC program itself. Literature shows that AT service delivery process needs to be client-centered, and to do that, to understand the client in a more comprehensive way. So additional to this comprehensiveness, the Reuters says that the service delivery process needs to show data on effectiveness and efficacy, and the best practice demands for outcome measurement. So we believe these are important implications to be aware of and to address, especially because they are very related to the core mission and vision of ATRC, that is to ensure equal access to technology to employees and to contribute to and draw from research and evidence-based practice. So addressing these needs or this combined need will improve ATRC client experience and strengthen ATRC program overall.
So now I'm going to be discussing our overarching goal of the program, as well as 3 specific objectives that help us break down each component of the goal. So our goal can be broken down into 2 main parts. First, to increase overall ATRC program effectiveness in regard to employee services, and second, to increase employee outcomes of satisfaction, performance, and participation. And that second part helps us ensure that we maintain a focus on those level 1 needs, those primary service recipients. And our goal is to see improvements within 1 year. And in order to make it measurable, we will be using a combination of client report via survey and PIAD scores, which we're going to break down over the next few objectives. So that leads us to objective 1. So our first objective is for the ATRC to implement a standardized outcome measure to collect data on employee outcomes by January 19th, 2021. This goal date corresponds with the beginning of the spring semester. Student outcomes are currently measured by the ATRC on a semesterly basis, and although not all employee service recipients are on the semesterly schedule, it's important that the measures are administered at regular intervals. And the ATRC is currently trialing use of a modified COPM, which is the Canadian Occupational Performance Measure, with employees. The COPM has the user rate importance, performance, and satisfaction in specific topic areas. And they currently use this with students, but it's challenging to translate this to use with employees, as the needs and outcomes of employees are often more varied than those of students. And so another option that we're recommending for the ATRC to use is the PIADS, the Psychosocial Impact of Assistive Devices Scale, which you can see pictured here on the left. It comes in the long form of 26 items or a short form with 10, but both are a self-report questionnaire that assess the effects of an assistive device on functional independence, well-being, and quality of life. And so we're currently going back and forth between the use of the long or the short version, as the long version has established psychometrics with internal consistency, test-for-test reliability, and construct validity, but we have not found any published psychometrics on the short form. But the ATRC has expressed a desire for brevity in their outcome measures, as this may lead to an increased response rate.
Okay, so objective 2 consists of finalizing and implementing questionnaires for employee service recipients, which will address subjective experience and satisfaction with AT recommendations and the ATRC service delivery process. In our research, we didn't find any AT-related assessments that addressed all of the areas that we believe to be important, so we decided to supplement the PIADs with custom-made questionnaires. These questionnaires, which there will be one for pre-service, one for post-service, it'll address areas that are not covered by the PIAD, so that includes demographic information, employee-based or employment-based questions, past experience with AT, the ATRC service delivery process, funding, and additional questions about client experiences with the AT devices themselves, including those that are directly influenced by disability, stigma, or lack thereof at CSU.
And then our third and final objective is basically a culmination of the first 2 objectives. The ATRC will synthesize and analyze data from both objective 1, the outcome measure, and objective 2, the questionnaire, to assess client-centeredness and efficacy of services for employees. Like we mentioned previously, the ATRC specified the desire for objective data for employee services, as they're currently working off of anecdotal evidence. Collecting data in the standardized form of the PIADs will allow the ATRC to assess effectiveness and track progress in regards to competence, adaptability, and self-esteem of employees using an assisted device. And the questionnaire that we're developing will focus on the service delivery process and satisfaction, allowing the ATRC to gather additional feedback on their services and adjust services accordingly.
Our program evaluation process will involve a systematic annual review of the data from the questionnaire and the PIADs. We suggest the ATRC staff complete this annual review in May, using data from the previous school year to inform and guide any changes that need to be made for the next school year in regard to service delivery or the measurement tools. Anna Walker will most likely lead this initiative, but any ATRC staff that works with employee clients should be involved in this evaluation. This table shows the kinds of questions that the ATRC staff will discuss during the annual evaluation. The goal of our program is to improve ATRC services for CSU employee clients and to improve client outcomes. So the goal of this evaluation is to see if the measurement tools have helped the ATRC achieve that goal. ATRC staff would want to compile data about which items on the PIADs were most frequently rated as negative, or given low scores and which items were given higher scores? Were there any trends in how the clients rated items on the PIADs, and why might this be? This could help target the ATRC target PIADs items that are frequently rated lower in their interventions. ATRC staff should also compile data that speaks to the effect of AT on client satisfaction, participation, and performance that can be found in the PIADs and questionnaire data. Importantly, staff should think about if they are missing any information to answer this question and to add this to the next year's questionnaire. Next, staff will think about the efficacy of ATRC services themselves. How satisfied were clients with their services? Did they feel like their needs and preferences were heard and considered? Lastly, ATRC staff will compare the results of the PIADs to the results of the questionnaire to see if this data is complementary or contradictory, to see if the measurements are working together. So what? The data of those questions will all help the ATRC think about which changes to make to better meet their clients' needs. They may make changes to the measurements themselves, like which data is collected, which questions are asked, how they administer the tools, or they may make changes to the services, the process, timelines, interventions they use, research initiatives, staffing ratios or roles, communication methods and strategies, or other internal factors.
So in order for this program to be both successful and sustainable, the ATRC will need a few resources and inputs. The ATRC is fortunate to already have buy-in from ATRC staff and access to employee service recipients whose buy-in will be earned through rapport building. The ATRC also has an existing intake and evaluation process for students and an intake process for employees, which are great places to build off of. We have identified, written, and recommended assessments that we believe will address the needs of ATRC employee service recipients, which takes care of the first need. Second, ATRC will need a feasible, concrete, realistic plan for implementing assessment strategies and analyzing results with a motivated team assigned to the task. We are recommending that the ATRC follows a similar process that they use for student service surveys, since this process has already proven to work well for them. We are also providing a template with some guiding questions, which was shown on a previous slide. And then lastly, let's talk about financial cost. It should be zero. The PIADS is free. Qualtrics is free through the university. At most, the ATRC will need to budget for a slight uptick in graduate assistant work hours to accommodate any tasks that salaried staff do not have time for during the yearly employee service review.
And last but not the least, here's our logic model. We have already covered the specifics of this model, but we just wanted to give you a visual for the resources that we have available, the resources we'll need. Marisa just talked about it. So the ATRC will complete the activities of administering the tools to employee clients and reviewing data for those tools to figure out how they are or not meeting client needs. And the outputs of this program include both the non-standardized measurement tool or questionnaire and the standardized measurement tool, the PIADs. A third output will be the synthesized data from these tools and a list of suggested changes for next year's services. So the outcomes of the program will be modified, ATRC practices that will better meet the needs of clients by being more client-centered and more evidence-based. The ATRC will also be able to share results and data from these tools to help optimize AD services for other organizations. And this in turn will result in the impacts of improving ATRC service efficacy by efficiently matching clients to appropriate AT based on needs and preferences, and improved employee and client outcomes in their job-related occupations and activities.
And that's what we got. Now I guess it's time for questions and feedback.